Hello and welcome to Mentoring the Mentors, an institute that accelerates your learning curve. My dear educators, this is Meenakshi Narula, and today we shall talk about mental health. Mental health awareness is really very important. Together, we can foster a supportive environment where everyone's well being matters. Mental health and psychosocial well being, they are the most neglected areas, especially in our country. They are considered like elephant in the room. Nobody likes to talk about such kinds of issues. The National Mental Health Survey reports like almost 150 million citizens of our country, they need care and support for their mental health and well-being. Unfortunately, 70 to 90% of these people, they failed to receive early, timely, quality intervention, any kind of support from the psychiatrists, from the counselors, from anyone. That's why they are going through that stress. If we talk about the teenagers, our children who step into the adolescent stage, as per WHO, the self-harm rates in the adolescent age group are found in the highest number at the global level. This kind of stress, it leads to difficulty in sleeping, irritability, fatigue, no concentration, heart problems, muscle aches, and different other kinds of physical illnesses. So even the psychiatrists, the counselors, the professionals, they agree that early intervention can prevent many future mental health conditions. The factors like physical illness, any kind of disease, any kind of problem, and even inability to provide the resources to self and family, that is limited basic resources and unfulfilled desires, they lead to mental stress, anxiety, and depression. A holistically healthy individual engages in productive activities, has fulfilling relationship with others, and has capacity to adapt. That is, the one is resilient in nature. So what we need to do is we need to provide timely intervention to support to our students. We can even lend a helping hand. My dear child, can I help you? So we need to provide easy access to mental health services at our school. That should be considered as the first, the foremost, the very crucial step. If we provide timely support and help, we'll be able to support our students to do better in academics. They will become flexible and adaptive to change. And let me tell you, many of the problems that arise because of the behavioral issues that can be addressed well in time. Almost one-fifth of the children and the adolescents, they experience mental health concerns like stress, anxiety, bullying, learning disability, and substance abuse. We need to join our hands together and pave way to smooth transitions that our children they go through. When the students they step into the school, they join the school at a very early age. So we need to focus on the physical, motor, social, emotional, language, and cognitive skills. We need to join hands with the families. With their support, together we can ensure these transitions easy and seamless for our students. Not only this, when our children they move from one stage to another, like pre-primary to primary wing, again there is a transition. There is a change of timings. The children they need to adjust themselves accordingly. There is change of seating arrangement, different heterogeneous activities they participate in, and we need to help them to acquaint our children to the new classrooms. Now, when this transition happens, like pre-primary to primary, obviously there is a shift from mother teacher or the homeroom concept to the subject teacher concept. The teachers they teach different subjects. Earlier there was a single teacher, the mother teacher concept. Right now the child feels worried, like there are a number of teachers So we need to make our students understand like transitions, they are natural and this is perfectly okay if they have got little worry. We need to organize introductory sessions where all the subject teachers to be introduced to the children so that the children they can be well prepared for the new class or the new block or the new school, whatever the case may be. There is another transition from pencil to pen. Earlier the children they write with pencil. Pencils always come with erasers. But as and when there is a shift, there is a transition from pencil to pen, they get little worried. We need to prepare them for the same. Ideally, 9 to 10 years of age, I mean, class 4 or 5 is perfectly okay for the students to start writing with the pen. Ensure like your students use good quality pen and focus on their fine motor skills and help to improve eye hand coordination as well. One more transition, primary to middle. Moving from primary to middle school. Again, there is a lot of transition, lot of change, lot of stress because the students step into adolescent stage. There are a lot of changes. If we talk about their bodily changes, right? So we need to organize some sessions on puberty, on bullying, and we need to provide them with various vocational or the skill courses as highlighted in NEP 2020 as well. We need to provide them with various challenging tasks like case studies or maybe project based learning, inquiry based learning, so that they can take the onus of their learning. Not only this, when they move from middle to the senior grade, like 9th to 12th, again there is a lot of challenges. We need to help them with the subject selection. Also, we need to organize sessions for, you see, cyberbullying and even career guidance. And we need to develop the characteristics like citizenship, character building, and other 21st century skills for our children. So, my dear educators, please make sure you stay tuned to Mentoring the Mentors if you want to know more about such important tips for teaching and making our classrooms engaging, enriching, and exciting spaces. Do like, subscribe, and share Mentoring the Mentors. Join us in order to achieve the objective, the SDG for quality education. Thank you. Have a nice day.